So one of the things that's so difficult for all patients who are making a decision about breast augmentation is, what size should I do? Am I going to be too big? Am I going to be too small? We're experts at helping walk you through that process. And at the end of the day, one of the most comfortable things to a patient is knowing that breast augmentation is readily reversible. We have an experience that 99% of our patients are very excited about their decision to undergo breast augmentation, even if later they wish they had been a little smaller, they wish they had been a little bit bigger, or, as demonstrated by this particular patient, a patient may decide a few years later, listen, I enjoyed my breast implants, I've been there, I'm ready to have them out. That is not a difficult thing for us to address.
I actually just went to the internet and I read the different sites about local doctors, and then I made my appointment with Dr. Laurence. That was the doctor that I chose. My husband and I came in for a consultation together, and when we left there, we felt so good about the meeting that I honestly chose not to pursue any other appointment. I felt like the initial interview was very strong because you asked me so many questions about what had made me consider the surgery, what the outcome could be like. You gave me the pros and cons, as well as had me kind of question my own reasons for why I was choosing to do this surgery. So that was pretty thought-provoking, and I think that I took that back home. My husband and I had conversations, and I would say it was probably about 6 weeks that then I decided to make the appointment and follow through. That process, then I was able to come in and talk about the sizing and go through that process with one of the ladies in the office. And I have to say that was kind of tough, because you don't know exactly what it's going to be. And I think kind of given my size, it was very difficult for me to kind of picture that. It was handled very professionally, and they used some rice bags just so that I could have an idea of what the sizing would be. I can't recall if I brought a tight t-shirt or tank top, or if it was provided. I can't recall. But that was kind of used to give me an idea of what things would look like. The person was very patient with me, but still, even I think anytime you see something for a brief period of time, then you go home and you're like, what was that really like? And you kind of question things, and I was really vacillating back and forth. The process from the surgery to the settling, it really wasn't that long. I'm trying to recall exactly, but I would say it was within the first 3 months that things were, pretty much where they were going to be. It really wasn't a difficult process. I followed the directions immediately after the surgery, but honestly, I did not have any complications. The surgery went extremely smoothly, and the recovery process was smooth as well. I really didn't encounter any complications. At first, initially, other than in certain social situations, like say with mother-in-law, those types of things, I felt very confident. I felt confident about my clothing. It was fun to go and buy things that perhaps I wouldn't have considered purchasing prior to. Going out on date night with husband was a lot of fun, and it was enjoyable. And I felt fairly confident at that point. And I didn't really lose confidence in the way that I felt about the way I looked, so much as my lifestyle started to change. I'd already been practicing yoga prior to the implant, but my practice has changed tremendously. It's really increased. I go 7 to 9 times a week now. I do advanced classes, so the things that I'm doing have changed as well, the types of postures. That was whenever I first started feeling like, oh, maybe this was a mistake. When I first started mentioning to him that I felt like maybe I'd made a mistake, he was supportive about it. He didn't really know what the process of an explant was. Neither did I. I started looking at things online, and that's when I discovered there just really wasn't a lot out there for me to read. there weren't as many personal stories as there were about implanting. So there was lots of things for me to read that way, both professional as well as just people's own narratives. With the explant, I did not find nearly as much professional or narrative. So that made it a little scary. So I would put it in the back of my head and leave it alone for a while. And then I would mention it to him again. And my husband was very supportive. He was, if that's what you want to do, then just do what would make you happy, because I want you to be happy. Fortunately, when I had my examination, as I was discussing explant, I did not have a lot of encapsulation. So it seems that the explant will actually be very easy. It'll be a simple procedure. So I feel very fortunate in that way. And I haven't had any pain or anything associated with the implant. I've had really zero challenges whatsoever. And it seemed like from the examination it was going to be a very similar process with the explant, that the doctor didn't foresee any problem. You explained that there would be a time that it would take a while for the skin to resolve to the point that it's going to resolve. And I left with the understanding that it would not probably end up exactly as it was before. Of course, I've also had children at this point, so I kind of am familiar with that stretching process. When I clarified, that would be something that I would expect would be similar to after having children.